Hi, and welcome back to the Dr. Ramsey Show. Today, we're going to talk about the impact that birth control pills have on a woman's body. And birth control, gave women freedom in the 1960s when they came out to manage their own fertility, which is amazing. It also treats PMS, it treats heavy menstrual cycles, cramping with our periods. There's two conditions that women can have that birth controls mitigate the symptoms. It doesn't treat the cause, but that's PCOS or polycystic ovarian syndrome and endometriosis. So it's not the cause, it doesn't treat the cause, but it does mitigate the symptoms. There are things that birth control pills do to the female body that are unwanted, which I'm going to go through a few. And I was looking over this subject last night and I learned something that I never knew before that I'm going to share with you. So we know that birth control pills affect the health of our gut. They affect the permeability, increasing leaky gut, thereby increasing inflammation throughout the whole body. A lot of women who start birth control pills develop allergies shortly after that because 80% of our immune system is in our gut. The one thing I didn't know that I want to share with you, and I hope I say it properly, it does alter our microbiome. I didn't know this. So there's this bacteria that's called estrobolome. I don't know if I'm saying that correctly. Estrobolome is the bacteria in your gut that metabolizes estrogens and produces something called beta-glucuronidase. That's an enzyme, don't worry about the long word, that breaks down estrogen, gets rid of the metabolites, and helps us maintain a healthy estrogen status. So it breaks down estrogen to its active form. In healthy guts, this enzyme is properly working. The estrobolome produced just the right amount of enzyme, beta-glucuronidase, to maintain healthy estrogen levels. In unhealthy guts, estrogen metabolites are not metabolized properly, leading to estrogen dominance, which isn't really a word, it's progesterone deficiency. But this bacteria gets disrupted by synthetic hormones. It gets disrupted by stress, it gets disrupted by alcohol and other medications. So we don't want to mess with our microbiome because that messes with our entire health. So I didn't realize that was the biggest thing associated with the microbiome was that one bacteria or enzyme. It works as both. Okay, so birth control pills flood yourself with synthetic hormones, suppressing others. It does suppress testosterone, lowering libido in women, and increasing cellulite because it decreases our metabolism. So we do have more cellulite, those of us who take, or not me, women who take birth control. It does increase the risk of breast cancer, uterine cancer, and liver cancer. I didn't know liver. I did know breast and uterine for sure. The liver is key to metabolizing, detoxification, nutrient absorption, blood sugar imbalance, and immune system function. So the liver gets impacted by birth control or synthetic hormones. And guess what? Chinese medicine practitioners or TCM practitioners focus on liver health when they're enhancing fertility. Birth control induces poor nutrient absorption. So we'll see low B vitamins, especially folic acid, riboflavin, B6 and B12, vitamin C and vitamin E, magnesium and selenium. So those nutrients should be taken if you're on the birth control and with enzymes to help you absorb. It does trigger autoimmune diseases like Hashimoto's. When the immune system sees these foreign substances, synthetic hormones, in the circulation, it launches an inflammatory response, which first leads to leaky gut, which we said, and then invades the entire system, like we said. There's a direct link between birth control and thyroid disease. It increases the risk of blood clots, we know. Synthetic estrogens do this. Synthetic progestins do this. Bioidentical estradiol does not increase clotting factors, thereby increasing the risk of stroke and heart attack. Only synthetic hormones do. And then these poor digestive issues lead to skin issues, acne, hair loss, infertility, depression, anxiety, and we said before, low libido. Oral contraceptions also increase the risk of candida overgrowth. We have candida in our gut when we're born to decay our body when we die, but it shouldn't become systemic. Because of the leaky gut that birth control pills lead to, we lead it to also systemic candida, which leads to brain fog, fatigue, weight gain, etc. I didn't know this at all. Oral contraceptive use is associated with a 24% increased risk of Crohn's disease and a 30% higher risk of ulcerative colitis, which are GI issues, autoimmune GI issues. So I just wanted to share some of the things to think about. So let's say you have to take the birth control. Then you want to do things to protect your gut. Glutamine is really great, digestive enzymes, and especially high probiotics while you're on the birth control to prevent of those deleterious events. Now, I want to share with you an alternative to oral contraceptives. This is what I used my entire fertile life. It's called a diaphragm. You put spermicide in, you put it in the vaginal canal, you leave it in 8 hours after you make love, and then wash it. So that sperm that comes around will die in a sea of spermicide. Now there's a new and improved one, which I love. It's much softer. It's much more pliable. See, this is stiff. This is very soft. This has a place for the finger to pull it out easier. Before we had to like go underneath this and pull it out. So I really love the Kaya. It's a one size fits all. I used to have to fit women for the diaphragm. Now it's one size fits all. CVS will carry them for you. You simply put the spermicide in, push in the vaginal canal. When you're done, you pull it out with your finger. So this is a barrier method. It doesn't mess with your hormones. It's just as effective as birth control pills if you use it every single time. The only thing you'll need is spermicide to go with it, and it's good for a lifetime unless you lose or gain 20% of your weight. So consider a barrier method instead of the birth control if you can. Yes, the barrier method will not treat PMS, heavy periods, cramps, but guess what does? Bioidentical progesterone. And it's very safe in every woman at every age, and it's very effective. So thank you so much for listening. If you have any more questions about birth controls, you can certainly call, set up an appointment with me, or you can consider going on the Kaya, which your doctor can prescribe to you as well. Thank you so much for listening. Have a great week. Bye-bye.